Welcome to How I Grew My Practice, the podcast where health professionals share the behind-the-scenes stories of how they built a thriving practice. Each episode will uncover surprising challenges, victories, and life lessons learned throughout their journeys. Let's get started.
Welcome to How I Grew My Practice, a podcast presented by Next Health. I'm your host, Alec Goldman. In this episode, we have Fred Menko, VP of Growth Strategy and Experience at Advantage Dental Plus. He's here to talk about Preventistry, an interesting concept. It's about building a culture of oral health care that empowers the overall health of patients. Fred, welcome to the show. How are you doing this morning?
Doing great, Alex. Thanks. Happy to be here.
So excited to have you. Fred, for our folks in the audience who do not know who you are, if you can share a little bit about your background, what you're up to over at Advantage Dental, and kind of how you got into the industry, and maybe a little bit about this Preventistry concept that you guys have going on over there.
Yeah. So my background is I've been doing marketing in healthcare for about 15 years now. Before that, was involved in digital and large media organizations. Advantage Dental is a chain of about 80 practices across the country. We're really focused on Medicaid, and my role there is kind of overseeing marketing, some of our business intelligence, and then patient and to a large extent employee experience at the practices as well. So that also covers some of the recruiting and things like that we do. What's the other question? Did I miss it? I know I missed a question there.
No, I don't think so. I mean, if you want to share a little bit about this concept of Preventistry,
So
way into our topic for today.
Yeah, so Preventistry is kind of our big idea. Like you said, it's around really empowering the patient to take control of their oral health and impacting their overall health. We really look at it as being three major components: making access to care easy. So that means everything from making it easy to get to one of our practices, to making the experience within the practice as seamless and as painless for them as possible. It's about having a really, we think, unique and differentiating experience, partnership between the care team and the patient, where they work together to find a solution that's going to improve their overall health and their oral health in particular. That can be anything from, the traditional brushing every day and flossing to really, look, you have 2 Cokes a day today. What if you just cut that back to 1? And that will even help. And then really looking at what we're doing with that patient and measuring the overall quality of care through our data and the information we have there to really drive a improved overall health experience.
That's awesome. I think you hear this weird stigma with dentists in the industry of people pushing product, and this sounds almost the exact opposite. And it's like, how do we make sure that people are living healthier lives and getting ahead of issues that would actually cause much greater expense? So I think that's an incredible thing that you guys are taking on, or taking head on. I guess when you think about setting goals for a DSO and trying to obviously grow, see more patients, increase revenues, I can feel that part of this Preventistry concept would increase effectively lots of cleanings, right? How do you mitigate driving successful outcomes and preventing bigger procedures from happening and growing something where we know that the certain procedures might be more expensive that are more reactive than they are preventative?
Yeah, so it kind of comes back to the idea that Preventistry is more than just our day-to-day care. It's a culture, but it's also we've built structures with Preventistry that have to do with our customer service kind of mantras and the things we focus on there, and also on our care. Our clinicians are actually measured on a clinical Preventistry kind of scorecard that we've created, and that our clinical side of the business is really organized around. And then at the highest levels in our organization, we have a Preventistry scorecard, and it's really 8 metrics, and it impacts everything from how easy it is for us to deliver the care to the overall experience that our patients are having, and then also kind of the measurable clinical stuff. So we're really trying to create that culture by looking at those data points at least once a month, by talking about how people should be treated and what that access should look like in the practice consistently. And then our business model is really built around a preventative structure. We have mostly a capitated population, so we're value-based care based, and so we're not necessarily getting uh, extra revenues for the more complex care. So we really can focus on that preventative stuff, and our docs production is tracked based on really an elevated credit for the preventative care over reconstructive. You're always going to get a new patient with great needs, and our goal is really to get them. I'm not a dentist, so I can't get too detailed in it, but to really get them to a very healthy state, and then maintain that healthy state and improve on that.
That's excellent. So I know that prior to our conversation, I think this idea of Preventistry is so fascinating. I think it's so great that you guys are, again, tackling that. But you said you have this whole dashboard. Kind of, what are the things that you're tracking around the concept of Preventistry? And I wanted to see if you were able to share that today with our audience.
Yeah, let me pull that up. I've got a kind of obfuscated view of it here, so let me share it and then get to a place where I can share it with you. Hold on. Yeah, there you go. Are you seeing that?
Yep.
All right. So yeah, we look at this dashboard every month and we keep it up to date. This one's a couple months old, and I've kind of obfuscated the data, but you can kind of see here we're tracking Net Promoter Score. We do a Net Promoter Score survey to every patient. We feel like we do really well with that, and seen some really big increases this year. We look at how many of our patients we're seeing with virtual visits or teledentistry, and kind of see that as an opportunity and something that we're kind of innovating around to see if we can improve kind of the number of visits a patient actually is getting with the dentist by using teledentistry, and really on emergent care, it's a huge lift for us. How many of our patients are getting sealants or caries arrest medicants, so things that will stop the kind of the growth of cavities. And then Workplace is our intranet platform. So we want to see how many, this is really the way we look at our employee engagement and how many of our employees are active on that platform. Advanced dental services that are not referred out. So how many of the referrals that we could be sending out to external are we kind of keeping inside of our network and making that care easier to get to? Show rate, how many patients are showing up for their appointments, and what percentage of them, are we not getting care for? Employment rate, so how many of our roles are filled, and then oral assessment compliance. We have 3 oral assessment tests that are used, and we look at those. We want every patient to get those 3 assessments on their visits, especially during a comprehensive exam. So really, these are the 8 metrics that we kind of look at and say, this kind of covers experience, it covers quality of care, it covers employee engagement. It really tells us how we're doing with our Preventistry culture overall in a quick look.
That's so awesome. So when you're reviewing this, what are some taking data, knowledge, or the information, taking information and turning it into action, right? So when you're taking a look at this dashboard, how are you going about on an individual location basis, going to the team and saying, these are the following changes that we need to make in order to better serve our customers?
Yeah, we spend a lot of time on external referrals and figuring out who are we. So external referrals is one where we constantly are talking because we're below our targets on that one, and we're really looking at what kind of procedures are referring out, where are those happening, are we lacking a specialist in that region, do we have some of the things that end up getting referred out are things that a general dentist can do, and so do we have a general dentist who's comfortable in those skills and we're just not aware that they're in the market that we could be referring to, or that could be taking some of those cases. Same with show rate. If we see dips there, what are we doing to improve show rate? We've actually seen a large improvement this year due to some of the things that we've done to try to improve that. and those were, things that took some time to get into place, but that we knew were going to have an impact on show rate. And so we've been looking at these data points and really looking for ways to improve on that on a regular basis on every one of them. Some of them are new and we didn't know what to expect this year. But we're pleased with kind of where we're at with them. And we're also always looking, it's an annual review process of what data points end up on the scorecard. So the ongoing discussion is, okay, we feel like we picked good things for this year, but what's next year going to need to be? Where do we want our focus to be looking at the business overall? Most of them stay. A few of them are, for us, just they have to be there so that we're looking at them and tracking them as a business. But every one of them we look at and have a discussion, especially if we see them drop off, and talk about what's going on and why did this happen, and what can we do to fix it, which is the action that's really, if you're looking at data, that's the reason you should be looking at it.
That's right. So can you talk a little bit about all the different tools? I know that we work together between Advantage Dental and Next Health, but what does the tech stack look like that enables and is really building this type of dashboard that you can view from a high level and kind of look down at all the different practices that you're helping and overseeing?
Yeah, so the tech stack is really every tool that we use in the practice, all the tools we use in the practice. So we're looking at our front end, our practice system and the practice management system that we have in place and grabbing data from that. We use Next Health, we're grabbing data from that. And then all the other tools that we have at our disposal, and we're pulling those into really a Power BI system, creating a data lake basically within and accessing it through Power BI to kind of create dashboards like this and several others that we use to, day-to-day manage the practices.
Can you talk a little bit about the relationship of, I guess, how you guys are leveraging specifically Next Health in the greater idea of Preventistry? Again, kind of like thinking back to no shows and
Yeah.
The door.
Show rate. If you think back to the dashboard, we saw some large jumps in May, and we've really been our valleys this year were January, February, and March. From May on, we've been really seeing huge increases, and that was aligned 100% with the launch of Next Health in our practices and the confirmations process. And I think if we don't look at this, but it's actually on our list of things to consider for next year, but actually, how we're doing against capacity of the practice, what percentage of total capacity are we hitting at all the practices? We've actually made that work really great with Next Health also with the kind of the wait list features. So if we have an opening in the last minute, we've had openings at practices, 10 minutes before the appointment, we get the cancellation, and we've been able to fill those with that waitlist functionality. So while that will show up on our show rate as being a negative cancellation on our show rate, we know that we're filling those gaps with technology that allows us to communicate much faster with patients. Texting and email are, in many ways, the preferred way that our patients want to interact with us, and it really helps us actually in the practice because it takes so much load off the phones. We don't have to. We're not calling out for confirmations as much as we used to have to. We're also not having to have inbound, scheduling happening as much because patients are comfortable scheduling online. They do their paperwork online. We're even looking to completely digitize that experience because we think it goes back to Preventistry. It makes the access to our practices that much easier.
So you mentioned that ultimately, even technology certainly helps the patients and how they want to communicate, but it certainly makes the lives of your staff much easier. Can you talk about how this idea of Preventistry also is helping the staff experience?
Yeah. So, our staff consistently is talking to us about how, other places they're feeling a lot of stress around production, around having to do a certain number of the more complex care. And here they really get time to spend with a patient, teaching them how to have better oral health habits. And so many of our patients, because we're Medicaid focused, are kids. There's so much that we can just teach them early on today that will impact the rest of their life. And the docs and all the staff really, benefit from, the fact that technology is reducing the amount of time that they have to spend on phones and things like that. They can spend that time having those educational conversations and and really making a difference in the habit instead of just treating issues.
So you've been with Advantage Dental for a few years. I guess one, how does this differentiate from past organizations that you've worked with? Would be my first question. And then where do you see Advantage Dental going in the next 5 years? Especially like kind of growing out this idea of preventistry and as you guys scale the organization even more so.
So how is it different? I mean, compared to places I've been at in the past, we are, well, so most of my background has been in the medical side of healthcare. So it's very different because it's oral health as opposed to medicine. But it is different even in those regards, and that the way we focus on production is very different. We're not really focused on production. We're really focused on seeing and impacting as many of the patients that are assigned to us as possible. We really are, mission focused. Our mission is to improve the oral health of all, and it is the mantra that we have every day, and Preventistry really is how we do that. It's really focused on having the biggest impact we can on the population that we're focused on, which is, the Medicaid population, who oftentimes has a hard time getting access to care, being treated and cared for in a way that's going to really change the way that they approach healthcare and in particular their oral health. It's the idea that we live our mission every day, I think is, you hear a lot of people talk about it. I'm sure people will think I'm just saying this, but we really do live the mission every day. We focus on really making a difference in each person who comes into our practice and in all the people that we're focused on caring for, all of our patients and assigned patients.
That's awesome. And what's next for Fred?
What's next for Fred? That's a good question. I mean, I'm really focused right now on, making the practices and patient experience as great as we can in the practice. Making sure we're getting great employees who are really focused on our mission and who put the mission first, and who can get behind the mission. I mean, that's what I do every day, and it's a lot of fun doing it. Great people to work with. Being great at what we do is what makes me happy.
That's awesome. Fred, we're coming at the 20-minute mark. What are kind of like a last concept or a last thought on Preventistry that you haven't shared with the audience that you'd want to share? What would you leave us with?
Man, I feel like I've covered a lot of ground on it. Really, again, it's the way we achieve our mission. It is really behind everything that we do. The only other thing I guess about it is you hear the word Preventistry and everybody thinks it's just about preventative care and about cleanings and those kind of things. And it's really about more than that. I think it's really about this culture and the idea of a culture of Preventistry of everything you do being focused on improving the oral health of the population that you're taking care of, and especially populations that, in our case anyway, have a really hard time getting oral health care, whether it's for time constraints and personal issues, or whether it's geography. Really, it's that access piece is a huge piece of what we do, and making it easy to get to us and convenient is a big focus, I think. That's a big part of it, Preventistry. And it's not just a clinical thing. It is something that people from our support teams, our shared services teams are focused on, all the way to our front desk, all the way through care.
That's awesome, Fred. Fred, it was so great having you on the show. I know that we're extremely appreciative of your time and having you as a CAB member at Next Health and all that you guys do with our organization. So I just want to say thank you, and thank you for joining the show today.
No, thank you. It was a lot of fun.
Awesome. We'll be in touch soon.
All right.
Thanks, Fred.
Thanks.